One of the things that was embedded in our DNA from the beginning is we really understood the importance of care coordination as a platform that we built the urgent care model on.
We're primarily focused on ensuring that when patients are identified at CityMD, we want to be able to coordinate the care back to their primary care to make sure that any diagnostic results, information we have, that's provided back to the PCP so that when the patient follows up, the provider has that information beforehand.
There was a big drive to automate and to create better systems that don't require manual input. Within one business day of the patient's visit to one of our sites, we send a visit summary to the patient's primary care. And initially that was a manual process, but since we realized what a big deal this was going to be in the future of exchanging clinical information with the primary care, we then came up with a system where it's automated.
One of the changes for us was our PCP referrals, and with that process we were able to expedite things, helping our patients get connected with primary care physicians in a more timely manner within the community.
When a patient enters their PCP information, we're able to fax over their consult notes with whatever went on during their visit with us. All that information gets forwarded to their PCP.
We at Montefiore have our own urgent care centers. And I think a lot of people were surprised to learn that, where they're like, well, you're partnered with CityMD, like how could that be? You have your own. And we recognize that there's not enough alternatives to care. There isn't enough access, there aren't enough providers. And so this is one of those situations where you can't afford to be competitive.
This is really a burgeoning front door of healthcare. I would encourage other urgent care organizations to strongly consider NCQA PCCC and where their place is in the healthcare environment to try and affect change in this manner.